Good afternoon and welcome to our webcast. You're informed of a positive test. Now what? For those of you who I've not met, I'm Dan Meyer, publisher of BizTimes Media. Today's webcast is presented by BT360 Content Solutions, the content studio and storytelling arm of BizTimes Media. On behalf of our presenters and sponsors, Accelerated Analytical Laboratories, R&R Insurance, and Reinhart Boerner Van Deuren, thank you for attending. Companies are coming to the realization that it's not a matter of if there will be a positive COVID-19 test within their organization, but when they'll be notified that one of their employees has tested positive. What should you, the employer, do in response? To mitigate risk, avoid disruption, and take a proactive approach to battling the spread of COVID-19. Not only is a positive test a sensitive topic, but it also requires you to act quickly as a business owner. Our presenters will give their recommendations for how to approach the situation when your employee tests positive for COVID-19, whether your employees are currently working from home, continuing to go into the workplace, or slowly returning to work. They will also address how to use testing as a way to mitigate risk and avoid business disruption, how to reduce disease transmission and employee fears with COVID-19 testing and screening, who pays for the testing, how do you stop it from spreading, what you can and cannot share, interacting with the local health department and OSHA, and guidelines for avoiding employment discrimination, retaliation, and wrongful termination. The slide deck will be available after you fill out the attendee survey at the conclusion. Before we begin, on behalf of BizTimes Media, I'd like to thank you for your readership support and for your print and digital advertising support and event sponsorships and for attending this webcast today. This is our 25th year as an independent family-owned business, and we're the only locally owned business media company in the region. However, to serve this community for 25 more years, we'll continue to need your marketing and advertising support now more than ever. I guarantee that we'll work hard every day to earn your business and to help you grow your business through our custom and integrated marketing programs, which can include BT360 Content Solutions. If you're interested, please contact our sales director, Linda Crawford. In addition, our award-winning editorial team is always looking for story ideas, especially forward-looking operational insight stories that can help our readers make more informed decisions in running their company, or insights how to be better leaders themselves. And last month, we launched our Insider Subscriber Program. For $8 a month, you can be an insider and receive several insider benefits, including access to all of the content produced by our editorial team. It's also your opportunity to support local journalism. So before I introduce the presenters, I want to mention that today's webcast is being recorded and will be available on demand on our website tomorrow. I don't think it'll be on today, possibly, but most certainly tomorrow. As a reminder, upon conclusion of the program, please fill out the attendee survey to access the slide deck, which will also be available. So now on to the presenters. When I introduce you, please give a quick shout out to everyone. Our presenters are Brittany Lopez-Nolid, shareholder with Reinhart Boerner Van Deuren. Hi, Brittany, and welcome.
Hi, thanks for having me.
Thanks. And Dave Metzger, CEO, President, Accelerated Analytical Laboratories. Hi, Dave.
Hi, good afternoon, everybody.
Welcome and thanks. And Maureen Joy, occupational therapist and healthcare specialist with R&R Insurance Services.
Welcome, everyone. Glad you could attend.
Thanks, Maureen. So during the presentation and discussion, please submit any questions that you have by using the Q&A feature in your screen. We'll try to get to as many questions as possible, including the ones that are sent in with your pre-registration. And at the end of the pre-registration, or at the end of the presentations, and the Q&A session, you'll find the phone numbers and email addresses of each of the presenters. And I'm assured that they welcome your additional questions because we'll probably not be able to get to all the questions. We've received several in the pre-registration group. So we're pleased to have Brittany Lopez-Nolid kick things off by providing us with some of the legal issues for employers related to positive COVID-19 tests. So as I mentioned, Brittany is a shareholder with Reinhart. So Brittany, I'll turn it over to you. Brittany.
Thank you. I'm happy to be here today. Thanks for having me again. I am going to take a step back and begin by talking about what you can and can't do. So if we want to jump to the next slide. So the first question is, what mandatory medical testing can we require our employees to undergo? And this is governed by the Americans with Disabilities Act. And mandatory medical testing must be job related and consistent with business necessity. So here, the EEOC has gone ahead and said that COVID-19 testing is appropriate here if it is accurate and reliable, because COVID-19 testing will allow employers to determine if other employees are bringing COVID-19 into their workplace, which would present a direct threat to other employees. Again, that testing must be accurate and reliable, and EEOC recommends that you look to the FDA and CDC for additional information on what that means if you are concerned about the tests that you are looking into. I think Dave may touch briefly on that also. And there are other tests aside from the COVID-19 tests. The antibody test is another one that you may be familiar with. In terms of using that kind of testing to determine who can and cannot come to the workplace, the EEOC has said that that is not appropriate for mandatory medical testing because it does not show who has an active case of COVID-19, and therefore it does not tell you if there's a direct threat posed by that individual. Again, another issue that may come up with implementing testing is if there is a unionized workforce, you may want to consult your collective bargaining agreement and determine whether this is a subject over which you're going to need to bargain. Additionally, you want to consider whether there is any impact, whether state or federal wage laws may require you to pay employees for the time that they are getting tested, whether traveling to and from a testing center or the time spent there, which, as we know and we've seen in the news, it may be a substantial amount of time waiting for those testings. So you're going to want to assess whether that time may be compensable. So if we jump to the next slide, and you've decided to implement COVID-19 testing, you're then going to be generating additional employee confidential medical information. And so you want to make sure that you are maintaining that in compliance with the Americans with Disabilities Act. And that means that medical information must be kept in a separate confidential medical file, separate from the employee's personnel file. If you already have these separate medical files, the COVID-19 related information can go in those files. It doesn't need to be in a separate COVID-19 medical file. The other big employee confidentiality question that comes up is when you have a positive case and you need to notify other employees who may have been exposed. And you want to be really sensitive about respecting employee confidentiality and complying with the ADA. So you want to let them know that they have been exposed and that they then need to self-quarantine in compliance with either their healthcare provider or the Wisconsin Department of Health and Human Services. One thing that can be helpful is making sure that your supervisors or whoever is providing this notification works from a script. It makes it very easy to avoid, a potential pitfall or slip up and say too much, and then you have this documentation of exactly what was told to the employees. Again, there can be some gray area here because when you have a smaller place of employment, it may be quite apparent who we are talking about. But again, especially in that situation, we want to stick to the script, even if otherwise that information can be deduced. The other potential wrench is when you have employees who are sharing their own confidential medical information. It's very common where you have an employee who comes down with COVID-19 and will go ahead and alert on their own their coworkers because they want them to be aware of it. So again, this is when a script is really important because you have a supervisor informing someone and the employee says, oh, sure, yeah, Sarah told me she was ill. That supervisor is not going to want to confirm that. They're just going to want to stick with their script because Even if an employee discloses their own medical information, that doesn't waive an employer's obligations under the Americans with Disabilities Act. The one other gray area with records, and I know I'm mentioning gray areas a lot, you know, we're less than 6 months into this, so I'm urging people to be cautious on certain topics, but is record retention. So there is a potential that these COVID-19 tests could be medical records under OSHA or employee exposure records. And if that is the case, those will be need to be retained for the duration of the employee's employment plus 30 years. So it's an extremely long retention period. So just make sure that your retention policies currently will retain those documents until that issue has been decided. So if we jump to the next slide, we'll talk about how to avoid potential claims of discrimination and retaliation when doing testing. The big one for discrimination is to make sure that you are applying your COVID-19 testing in a non-discriminatory manner. So make sure that you are not targeting particular groups of individuals, specifically individuals that are in any sort of protected class, whether it's age, national origin, disabled or perceived disabilities. So make sure that you are applying this policy fairly, because otherwise, even if you are testing with the best intentions, if you are targeting a protected class, that can expose you to a discrimination claim. The next issue is retaliation, and this really comes up when you have employees that refuse testing. And the first thing you want to do is determine what is the reason for the refusal. There are a number of statutes that may come into play based on the basis for the refusal. If it is a medical or religious reason, you want to determine whether you can accommodate that without an undue hardship, because employers have an obligation to accommodate sincerely held religious beliefs, and obviously to accommodate, to provide reasonable accommodations for disabilities. So go through that interactive process, determine whether you can accommodate without an undue hardship, and as always, document that process. Other reasons may be related to protected concerted activity. And I know we think of the National Labor Relations Act in terms of unionized employers, but it's also going to apply to most employees. Generally, they have this right to engage in protected concerted activity. So to discuss, to protest, to object in regard to working conditions, which include safety and health. So if you have employees that are protesting or objecting to COVID policies, including testing policies, you want to make sure that you are being very cautious in issuing any discipline, because you could be subjecting yourself to an unfair labor practices claim. You also may have employees just that simply choose to refuse testing. And in that case, when you've kind of walked through this process of assessing the basis and there really isn't a basis that would require any sort of accommodation, you do have the right to discipline as you would with any other safety policy that employees are not complying with. So go through your normal process for applying discipline and document that. So the next slide, the final topic I'm going to talk about is the Families First Coronavirus Response Act. And this is going to come into play when you have employees that either are quarantined or have COVID, and they may be entitled to paid leave. And the FFCRA expands FMLA to provide for 2 additional types of leave. The first is up to 2 weeks of paid sick leave for individuals affected by the coronavirus. And the second is this expanded FMLA leave for employees that need to take time off to care for a child. This is a pretty complicated topic, and this is just a primer. The Department of Labor has 97 Q&As on this act alone on their website. They're really helpful if you want to look there. Reinhart has done several presentations and webinars on this that are going to be available through the handout that we'll send along with the materials, kind of a cheat sheet. And that cheat sheet is going to go over these two types of leave. So if we jump to the next slide, the first type of leave is the emergency paid sick leave. So again, this is up to 10 days or 80 hours for 6 conditions. And the 6 conditions fall in 3 main buckets. The first bucket is those affecting the employee themselves. So the employee is subject to a federal, state, or local quarantine or isolation order coming from a government entity. The employee has been advised by a healthcare provider to self-quarantine due to COVID-19 concerns, or the employee is both experiencing symptoms of COVID-19 and seeking a medical diagnosis. So it needs to be both of those pieces to qualify. So if an employee has decided unilaterally to self-quarantine and is choosing not to get a test or talk to a healthcare provider, they do not qualify under this number 3. The next bucket is employees caring for someone else. So if you are caring for an individual who is either subject to a government entity's quarantine or isolation order, or if they've been advised to quarantine by a healthcare provider, you may qualify under number 4. The next one is caring for a son or daughter whose school or daycare has been closed as a result of COVID-19. And the final is this miscellaneous employee is experiencing a substantially similar condition. And this has not really been fleshed out at all. So for now, this one is not really a big issue. The level of pay you're entitled to varies based on your reason for taking leave. If it's reasons 1 through 3, the reasons kind of personally affecting the employee, you are paid your regular rate, but no more than $511 a day. And if it is any of the other reasons, it is 2/3 of your regular rate, but no more than $200 a day. Employers may not require their employees to take other paid sick leave that they have as part of their benefits prior to using this emergency paid sick leave. And there's no employment requirement. So even if the employee has only been with you for a few days, they are entitled to take this emergency paid sick leave. So the next slide is going to touch on the other type of leave under the FFCRA, and that is the expanded FMLA. So this does have an employment length. You must be employed by your employer for at least 30 days. And then you are entitled to take this leave if you are caring for a son or daughter and their school or child care provider is unavailable due to COVID-19 precautions. For this one, you have 2 weeks that are unpaid at the outset, and then you have 10 weeks that are paid at 2/3 of your regular rate, but no more than $200 a day. So for the first 10 weeks that are unpaid, your employees can, but you cannot require them to use other leave. So if they want to use their emergency paid sick leave or their other paid time off, they can do so. But again, you can't require them to do that during these first 10 days. The last 10 weeks, when they're paid at 2/3 of their regular rate, capped at $200 a day, you can require them to first exhaust their PTO, but you would pay them at 100% of their salary while they're using that PTO. The last thing I want to touch on is documentation, because it is a little bit different than normal FMLA. There are some reduced documentation requirements that were intentional to encourage employees to use this leave and to, stay home to try to stop the spread of the virus. So employees can request the leave by providing their name, the reason for the leave, and a statement that they're unable to work because of, whatever reason they're taking the leave. If they are taking leave pursuant to a state, federal, or local quarantine order, you can ask which government entity is issuing the order. If it is for childcare, you'll want to get the name of the child, the school or childcare provider, and a statement that there is no other suitable person that can take care of that child. Finally, for taking leave when you have an employee experiencing symptoms and seeking a medical diagnosis, You can ask what the symptoms are, and you can ask when they are getting a test or seeing a doctor, but you cannot require them to provide you with follow-up documentation or certification for that visit during emergency paid sick leave. So again, that is different than FMLA leave. And if you have an employee taking emergency paid sick leave who then transitions into FMLA leave after the 10 days, at that point, your normal documentation and certification requirements could kick back in, and you probably would want to make sure at that point that you continue to apply those policies fairly to everyone. So that is all of the information I have for now. I see we have a lot of questions coming in, so I'm looking forward to getting to those, and I'll turn it back to Dan.
Thanks, Brittany. Yeah, there'll be a lot of follow-up questions as we try to navigate through all those issues. And thankfully, this is a recorded webcast, and it will be available tomorrow on the website, so you can all refer back to it. So as a reminder, I see a bunch of questions coming in. Please submit your questions. I mentioned that it's recorded, and afterwards, if you can fill out the attendee survey. So next up is David Metzger, CEO President of Accelerated Analytical Laboratories. Dave will discuss employee testing options, what happens after a positive test, and long-term planning. Dave, I'll turn it over to you.
Thank you, and thank you, Brittany. A lot of great information there. To everyone listening today, you can see my video feed is not live. Part of what we do here at Accelerated is very confidential, so we are not allowed to have cameras in the facility. But I'd like to jump in, give you a little background about what the testing program looks like, what you can expect for your team on site, and how we can interact to help with some of those issues. Mary, if you could scroll ahead one. This morning I heard that we set another record as Wisconsinites in the number of positive cases. You know, we are definitely trending in a certain direction, and it's not a good trend. So as things are here in Wisconsin, you know, with the percentage of positive results as they are, I get asked the question very often, what should we expect in a second wave? And what I tell people is that, you know, we don't know what to expect. We don't know what's going to happen, but I'd like to point you to an article that's in this issue of BizTimes, where we're talking about, where you know, Lauren from BizTimes is talking about, there isn't going to be a second wave because we haven't gotten rid of the first wave. So because of the fatigue we're all experiencing as part of this, I think that we're going to see numbers continue to increase, and we're not going to see a clear trend towards, you know, a decrease here in Wisconsin and an upswing to a second wave. But anyway, getting into what it is that, what happens during a sampling event or what your employees and team members can experience, there are two major differences or two major techniques that are being employed today in diagnosing this condition. The first one is what's referred to as an active test or a molecular test, and that is what most of us are familiar with. That is the image that we see on TV of a swab being placed into the sinus cavity and a sample being drawn like that. I did actually have a nasopharyngeal swab done on myself just to see what it was like. And I can tell you it's not pleasant, because as far back as they go, it feels as though they're trying to get to the back of your skull. So it's definitely something that you don't want to have more than once. And then, you know, to make things worse, they pull it out and then they go to the other side. With our personal operation, what we've decided to do is we've gone to what's called a mid-turbinate swab, or about an inch into the nasosinus passage. So very tolerable, and you get more buy-in from your team because there isn't a great deal of discomfort, fear, or anything related to that when taking the sample. Additionally, we are currently looking into saliva samples. We call them sputum samples, or maybe even spit samples. We also can offer a cheek swab as part of our offering. We are validated on those kinds of swabs. So easier more easier to get buy-in, I guess is the way that you'd explain it. So those are some of the differences in how we collect a swab and the types of swabs that we're using. The second major aspect of the containment plan or the box-in plan for COVID is serology or antibody testing. So antibody testing is done one of two ways. It is through a finger prick or through a venous draw. The finger prick is very similar to anyone who's witnessed or may have diabetes. You know, you take the needle, you'll make a small prick into your finger, draw out some blood, and then we can test it on what's called a lateral flow device. And it's very quick, very simple to do. The venous draw, that's where we're talking about, you know, a phlebotomist being on site, drawing samples. It's a large, I don't know if that's the right word, but it's a large implication to your operation in that you're going to have a lot of downtime. It's something that's going to take a fair amount of time to do. Whereas with the molecular swab, our team can come in and do about 25 swabs per hour per nurse who's swabbing. So it's very, very efficient. Serology work is also interesting. We saw a very interesting trend early on. People wanted to know more and more about antibodies. Did I have it? Have I had it? You know, those are the questions that came up. And we're now seeing a trend back to the molecular swab, and I think it's a twofold reason. First of all, if you do take an antibody test, there's really two conclusions that you can draw, or maybe three. So you either have never had it, you have it, you know, you're positive for antibodies, and you may actually be infected. So people who take serology tests, if they have antibodies, immediately need to take a molecular swab anyway, because part of having those antibodies in us may designate the fact that we have that infection active. So my recommendation is always start with a molecular swab. The information is much more poignant to what it is you're trying to accomplish. There's a lot of talk about antibodies and how long they last in our system, and you know, what's the usefulness there. In our personal practice, I have seen people who have tested in May positive, June negative, early July positive. So that's concerning to me, but you know, we can leave that for some of the doctors to discuss. But it points a trend to me that antibodies may not be the best way to diagnose this condition. Other things that we're working on are surface wipe sampling. There are a lot of services that contact us and would like to get an idea of, well, if I come in and clean up a facility, how much RNA or how much virus was present at the beginning, and how effective was I in cleaning it out at the end of my service. So that's something that we're going through and validating as well, to make sure that we have a comprehensive offering to, you know, the public. Mary, if you could move over one slide. Thank you. So what are some options for your team members should they need to be tested? So you have a lot of public options that are available. You've got your Walgreens and your CVS's and drive-thrus. As a lot of us are hearing right now, at Walgreens and at CVS, you know, people who are sending to the national reference laboratories, they're experiencing a very long lead time, sometimes 8+ days. And you have to wonder, if you're waiting 8+ days for a result, how useful is that in the first place? So here in Wisconsin, Department of Health Services has put together a really strong team of network laboratories, and that allows us to turn results in 3 days or less, oftentimes hitting the 48-hour mark as an average. But getting back to the publicly provided sites, drive-thrus, just a little bit before this presentation, I had a friend call me and say, hey, could you help out with some testing, some swabbing? My kids cannot get back into a baseball program until they get swabbed, and the expo center closed down at 10 a.m. because they ran out of supplies. So there are a lot of things in the public sampling market where it is difficult, especially for a business. And you know, some businesses that we're sampling have 700 to 1,000 employees that need to get sampled. With that in mind, some of these publicly provided sites are not a real option for that company to jump in and get the sampling done, because logistically, it's just not going to happen. So other options or scenarios that could occur is you could have Wing or the Wisconsin National Guard come out and perform a mission on site as authorized or ordered by Department of Health Services. And Wing or the National Guard will come in after a problem has developed. So what we would call an outbreak has occurred. So outbreak being defined as greater than 10% of your population flagging positive. There's a great deal of loss of control for the company at this stage, because now you have a situation where Department of Health has the ability to shut your facility down for 2 weeks. You know, early on in the COVID epidemic, we heard about this in some meat plants, and it's a scary concept for business owners. The National Guard is going to come out, and they're going to set up shop. This is a big operation. They're going to be out front and center of your building, and everybody's going to be able to see it. So it is a bit of a PR nightmare in my personal view, and it is something that you'd like to avoid. There are on-site testing programs such as ours that have been put together through strategic relationships, such as what we've done with RIM Occupational Health and Endpoint Solutions. So in an on-site testing program, a business is really able to control the environment, the testing, and the response to the problem of a positive. And what we're able to do here is, through a great deal of efficiency in logistics, we're able to schedule an on-site internal sampling of your team across all 3 shifts if necessary. So we're able to come into your facility, we'll set up, we'll work with your HR department and help you to generate, a program that's going to meet your needs. As a general rule, any on-site sampling, we shoot for 48 to 72 hours to get results back to you, and we will communicate directly with your HR team to do so. So again, it's a private sampling versus a public sampling, or the third option being, can you get your team together to a public site? So Mary, if you could scroll over one, please. Thank you. So inevitably, as Dan said on the outset of our webinar today, it's not if, it's when you get that positive result. And it will come. If you're not looking, it's there. So what happens when you do get a positive? So on our team, we have medical providers, and our medical team will call the HR department of the company that we're working with. We'll work with them to identify the positive, so that patient, and get them into a quarantine situation. So at that time, because we have medical staff that can work with you, any questions that might come up that are medical related, we can answer those immediately. We do make those calls 24 hours a day. So at 1 o'clock in the morning, if a positive comes through, our team is on the phone making sure that your team is notified and that you're given as much notice as possible to get that person out of the population. And this is something that really needs a lot of communication amongst the team. We did have a situation early on where one team member flagged positive and brought that result back into their place of business and handed it to their employer. And I had to giggle a little bit, but again, I think it highlights the point that you have to communicate with your team what you want done, how you want it done if a positive is detected. As a general rule, we're going to ask that employees who are positive stay home for 14 days. And we're going to give you some recommendations as well as far as internal contact tracing. Whenever you speak with a contact tracer, there's one question that always comes up. Who are the 5 people that you spend the most time with? And believe it or not, a lot of times people respond with people they work with in their particular environment, whether that be a line worker, whether that be an office worker. Offices are the #1 mode of spreading this virus around. So we have to be cognizant of that idea and think up ways that we can combat it. So contact tracing is not something that we currently offer, but we can certainly help the team understand what the needs are so that they can very quickly start to reach out to their team and other team members that may have been exposed and start to develop a plan of getting everybody tested. So we recommend, in addition, we hear it 1,000 times, we're fatigued as a state and probably as a nation about masks. We recommend wear the mask as much as you can. It's going to help reduce the transmission of the virus in a workplace environment. We also have a lot of opportunity with helping you to develop the OSHA infectious disease response plan. So that's something that we can help with and implement with either your safety team or your HR team. So we also recommend that you screen people or have a policy in place that will discuss symptomatic versus asymptomatic. If you're symptomatic of a respiratory illness, here at our facilities, we ask that you notify us ahead of time and screen yourself using the CDC outline. Are you using respiratory symptoms? Do you have a fever of 100.4 or greater? Things like that. So we're also putting that into place here at our facilities, and we make that recommendation to any partners that we're working with on the outside. So Mary, could we jump forward again? So long-term planning. What can I leave you with? What ideas can I leave you with? Before we get into questions. So the CDC recommends testing every 14 days. So we call that strategic or cyclical testing. So why do we recommend cyclical testing? So cyclical testing is important because we can constantly move positive cases out of the work population. And I think there's a twofold benefit to that. First of all, it's proactive. Second of all, the Department of Health is notified of every single positive and negative test that's done in the state. So they do understand which companies are being proactive, which companies are definitely trying to control micro outbreaks within their population. So I think it's it's an important concept to understand that cyclical testing with a plan to scale or step that down is very important to the long-term success of controlling it, or as the state says, boxing it in. So one thing that you can do as a company to help make decisions about should you develop or get into a cyclical testing program is you can compare your personal workplace environment against that of the community and what's going on locally in your community. So you can get a lot of that data online, and I won't get into how you would find that, but in communities where there's moderate transmission, we would recommend at a minimum that you're testing every 3 to 4 weeks. But in a community where there's a high transmission rate, we would recommend that you step that up to bi-weekly testing. And that's something we can discuss if anyone has questions. So again, take a look at a metric. What is the cost of a shutdown to your facility versus the cost of testing your employee population? What we found is that most businesses we work through, while not planning to spend this amount of money on a testing program, which is completely unexpected for any business, but we are able to work that metric with them, and they see that a shutdown and loss of income from that perspective far outweighs any cost of monitoring an employee population. So we're very much aware of it and would love to have that conversation in the question and answers as we move forward. So one other thing that I'd like to point out is that OSHA response. So OSHA has gotten out there and said, we need to have certain plans in place. And a strategic partner that we use to answer those questions is Endpoint Solutions. And they're a great resource for anybody who has questions. I'm not an expert in that area, so I can't talk too much about it, but I would definitely recommend reaching out to them for questions. So that's the basic idea of what I'd like to present to you today, and I'll certainly spend some time in questions and answers to get into details.
Thank you very much, Dave. I know a question in everybody's mind we'll get into after Maureen is, what's the range of cost and what can companies expect, and so they can assign it to some kind of an ROI. So thanks
Sure.
again. Our final presenter, before we address some of the questions, is Maureen Joy, occupational therapist and healthcare specialist with R&R Insurance Services. And Maureen will provide some risk mitigation strategies. So again, if you have questions, please submit those into the Q&A feature rather than the chat feature. So Maureen, I'll turn it over to you. Maureen.
Thanks, Dan. And again, welcome everyone for being here. As Dan mentioned, I'm an occupational therapist, so the first 10 years of my career before I went to the dark side of insurance I was working in healthcare, caring for those that were sick. And still, my family is very, very involved in healthcare, and I have many family members throughout the state of Wisconsin. So I am just overwhelmed with the turnout today, that we have employers that are looking to become more informed and play a part on slowing the spread. So what we've had so far is Brittany has given us some really good legal direction that we should be going. Dave has spent a lot of time sharing with us testing strategies and effective options. This last section, what we're going to do is I've got a 5-step process. I always say to my kids, if I could do it on one hand, we can get it accomplished. So I've got a 5-step process that you're going to be able to leverage as you navigate this COVID-19 impact in your workplace. My role at R&R is in risk management, risk mitigation. And I always say, if my job is to help you, the employers, understand what is the risk and empower you with some solutions to make good business decisions and change the outcomes. So then we have a win. So here we go. If you could please advance the next slide. All right, before we jump into those 5 slides, and Dave kind of touched on this just briefly, I wanna talk a little bit about what that plan should be before the crisis, before we have that first case. I want to start with a disclaimer that if you are on the call, and I know there are many of you on there that are healthcare related businesses, your portion of some of this portion of the presentation, you're going to need to do a little bit more homework. CDC has some very good guidelines out for the various practices within the healthcare space. And I can certainly direct you to that offline afterwards. But I hope you stay with us, because I think for the remainder of the presentation, you're going to get some really good tips that you can use as a launch, no matter what your business is. So I always say the best approach to reaction is a proactive plan. And then you're not going to be scrambling when the first case comes in. Having an internal team with the right members who can make timely decisions are all the difference of employers that I'm talking to on a multiple time daily basis on how are they addressing COVID when it strikes. So this morning I had a conversation with a gentleman, and at some point in the conversation, and he was frustrated. He was like, I don't have time for the rest of my job. And the minute that comes out, I know I'm talking with a client that has an army of one, and they didn't have a plan. So if those of you on the call don't have a plan, I've got some resources to redirect you for developing that written infection control plan. If you have a plan already in place, now's your opportunity to say, how good are we living that plan? So if you need some help, Dave and Brittany have given us some assistance, and with the additional links, it doesn't have to be that complicated. So the last point, before we jump into our steps, I want you to really think about communication of your expectations. now that you know what those expectations are. I can tell you, as a professional trainer, people learn different ways, even outside of a crisis moment. People don't just pick up a document, read it one time, and soak it all in. So I really want you to take a step back in order to have a successful outcome in this time, is to think about how have you communicated with your employees first, your customers and your vendors. Keep it visual if you can, versus just a very long document. Here at my company, my R&R, we get emails, very short, very sporadic. We have different visual cues throughout the office that gives us pointers on our self-temperature self-monitoring workstations, and hand washing. So CDC, OSHA, and a lot of your professional organizations have great visual tools. So lastly, I'll just leave you with, you're going to have some employees that just don't feel this applies to them. But I can tell you, in the last 4, 5, 6 months that I've been working with employers on this, once it becomes close to their bubble, their circle of family and friends, that's when some of those people make the change. But for the most part, employees are taking the information in and making good decisions. Next slide. All right, so let's start talking a little bit about step 1. And Dave kind of referenced some of this already, but here's a really good point, that you need to understand this virus presents with a spectrum of symptoms that for some of us, we've experienced is a symptom like similar to that before. But what we're learning as we go along in time, as the health professionals go along in time in treating this virus, it has an impact, is very, very variable. So you're not medical professionals, but what you can do is make sure you communicate to your employees. If you're not feeling well, stay home. If you get sick when you're at work, you need to notify your supervisor or HR or whatever your policy is and go home. How long should you stay home? The CDC and the Wisconsin Department of Health Services gives us some very good guidelines. They follow the time and test motion, and certainly I refer back to those on a daily basis as I'm referring back to customers' questions. For the benefit of your employees and your business, show concern, act quickly, and communicate on a confidential basis, and you will move through this and have a winning situation out of a bad situation. Step 2, if you could advance, please. So, with a positive test, Dave referenced, they're already going to be in a state database. The health department is going to be reaching out to that employee for community contact tracing. Any person that's identified inside the bubble of that positive case or positive person is also going to get a call for a short conversation. So again, daily questions that multiple times in a day, I'll have an employee and that comes into their employer and says, I think I've been exposed. And the employer goes, oh no, now what do I do? So here's a really simple rule for you to follow. And I'm going to say it a couple of times. Close proximity, 6 feet for a prolonged period of time without PPE of 15 minutes or less. Excuse me, 15 minutes or more. And Dave was talking about who are the 5 people that you talk about. I recommend that you go back and take a look at who have I had contact with in the last 72 hours. Now, as I was looking at the list of attendees, many of you are in HR, operations, maybe even safety. you guys are very good at looking at incident investigations when you have an injury in the workplace or some kind of accident. Use those skills and start asking who and what. So for the contacts, what are the contacts inside of 6 feet, more than 15 minutes in the past 72 hours? As you do your discovery, also ask, was the contact inside of a building versus outside of a building? There's really good information that'll direct you in that place. Was it with or without a face cover or some other type of PPE? Think about what are the hygiene practices? Are they sharing equipment? I had a customer that had the unfortunate experience of having 5 employees become positive over a short period of time. And we after detailed investigation, it came down to the first 2 were buddies that rode together to work. They had a really good infection prevention plan at work, but they were still seeing people becoming positive. And it wasn't until we paused and started asking about who's sharing what equipment and tools that once we identified that and made the correction, we eliminated the exposure. So take real detail look into your internal investigation, and that's going to help you with the next step, which is notifying employees and maybe making a determination, do we have to shut down the portion of your business? So next slide. Step 3 is that employee contact. So employees within close proximity or now are symptomatic, they need to go home and stay home. Dave referenced that a little bit earlier. And yes, you will have to tell some of your employees now is not the time to go on vacation. It is okay to declutter your house, clean out your basement, do some weed pulling in the yard. So you just want to make sure that they're staying in isolation. We've referenced a little bit earlier about lunch buddies and commuting partners. We also want to take into consideration that you're, at least as much as you can be aware, other high risk or medically challenged individuals within your organization. So the question that I have most often is, when does that 14-day start? And there are many variables that come into play, and you'll have to look at them individually. But for a short answer, start with the last day of the exposure. And then once testing is done or advice from the medical professional or public health, then you will adjust from that point. So next slide, step 4. Clear, ventilate, and disinfect the areas. So thinking about the work areas in this situation, determine, can you distance others from that area? If you can, waiting 24 hours before you do that decontamination or that disinfecting is desirable. But it's a good time right now to think about, can I open windows or doors? What is the building ventilation? Are we operating at its highest efficiency? When is the last time the vents were cleaned or filters were changed? So take all of those things into consideration. When it does come to decontamination or disinfecting of the area, the CDC has some very excellent guidelines on cleaning inside versus outside. They will also give you some guidance on personal protective equipment. My recommendation is N95 if for someone who's cleaning a contaminated area because it's tight fitting. If you don't have that, then a loose fitting face cover. If possible, protect the eyes because the virus still can come in through the eyes. Gloves and a gown. If a gown isn't available, then having the opportunity to change their clothes, immediately shower or shower as soon as possible after is good practice, and then right away laundering. There are services that are out there and will do disinfecting for you. You just want to make sure whether it's your employee or that outside service, they know what they're walking into. And when it comes to that shutdown decision, there are really more variables than probably can be covered on if I had the whole time for the webcast. So what I'm going to ask you to do is do that good investigation, have a conversation with your local public health, corporate attorney possibly, your insurance agency or carrier, and they're going to help you make the right decision, whether or not you need to shut down a portion or all of your business. Okay, step 5. Remember, I just said, if we can do it on one hand, we got it covered. So we're in the home stretch. So what I wanted to do is just give you a high-level view as well as some good resources to make those decisions, because maybe you're not going to need them today, but you're going to need them someplace in the next few months. So you as an employer do not have to call or contact the CDC or the Health Human Services, who are tracking all of those numbers. Public health or your healthcare provider will take care of that for you. On an employee's behalf, you do not need to call public health. If they go for a test, they're already in the database, and public health has either had the conversation or is going to be having that conversation. And that happens sometimes within the day or within 2 days of getting scheduled. Now, a place where you might be engaging with the health department is they may call you if they are have a concern of something heating up in your area, or they would like you to call them if you have 2 or more employees at the same time. And just to give you a little bit of expectation, this is a very casual phone call. This is not, hopefully, in the situation that Dave was reporting earlier where the National Guard was setting up shop. What they're going to be doing is trying to understand, is your business a restaurant? Is it a manufacturer? Are you a warehouse? And then they're going to ask you questions about your infection control plan. So talk about your controls. You have 6 feet distancing, or if not, you have barriers, you use PPE, you have a hygiene program, you're doing on-site self-monitoring of symptoms, whatever those experiences or controls that you're putting into place, be able to talk about them. That conversation, every employer that I've had involved in it, it's a very educational exchange of information. So feel comfortable having that contact. I know there's some questions, lots of questions about OSHA, and that really depends. So OSHA understands the gravity of a community-acquired infection and illness that COVID is. So there are 2 very good documents I'm going to direct you back to that are found on the OSHA COVID site page. And there are 3 criteria that you really need to follow. First, it has to be a confirmed test, a legitimate test. In the beginning, the tests were a little bit scarce, and I think there were a few bootleggers out there, and I think Dave and others have made sure that's gotten taken care of. So it has to be a positive test. It has to be determined that it's work-related. Now, your internal investigation will help with that process, but if you're beginning to question the work-relatedness, what I'm going to ask you to do is that's the time you pick up the phone and have a conversation with your insurance broker and the insurance carrier, because the carrier will do an investigation if you feel it's work-related, and help you with that determination. And the 3rd requirement is it has to meet all of the general record-keeping requirements. I'm going to give you an example. If you had an employee that tested positive and you felt it it was related to work exposure, and you were able, they had a mild case, and they were able to not require outside medical attention, but they had to be quarantined or isolated, and you continued their work schedule from remote working, that doesn't meet the OSHA requirements. So make sure you've got all three of those categories in there, and refer to the frequently asked questions, or follow up with one of the other resources that we've been able to identify so far. And then lastly, we already touched on when do you notify your workers' compensation carrier if you believe it's work-related. Have that conversation with your insurance agent or broker, and they can help you navigate. Next slide, please. So what I've given you here is just a cheat sheet, a summary of those 5 steps. Hopefully you're keeping all of our slides and using them as a reference from now until we're done with this COVID thing. But if not, keep this one slide, and it's a good checkpoint if and when you have an exposure at work. And then in closing, next slide. We just want you to remember, you're not alone. If there's any consolation, there are employers all over the world, unfortunately, having this same conversation. So my advice is take a deep breath, ask for help. It's frustrating, but you have to understand this is a very changing illness. Things change on a regular basis. So how do you stay up with the changes? My tip is CDC and OSHA have 2 very good sites that you can sign up for notices. They only push out the notice when there's a change. It just comes in as an email. There are other sites available, as well as maybe from some of your professional services associations. So with that, go back to your infection control plan and your internal team and see if you need to make any tweaks or changes. So with that, I'm going to hand it back to Dan.
Great.
And then I think we're ready for some questions.
Yes, we've got a lot of questions, so we're going to get going on those quickly and try to answer as many as possible. And I'll jump right in. Brittany, and again, if it pertains to your area, please jump right in. So can the employer make an employee get tested for COVID?
Yes, and I did see that there was some questions about can you implement testing when there hasn't been a positive case yet? And you can. You know, these are part of a proactive safety policy. So you do want to assess, you know, the exposure risks at your facility and whether it is appropriate to consider implementing testing, whether it is a one-off or cyclical testing. And, you know, so I should caveat that obviously there is the potential that you may need to make accommodations, but otherwise, yes.
Sure, and keeping with sort of that thought, so how do you handle indirect exposure? And if you could touch on the liability for the employer or the employee, if an employee's child was exposed to someone who tested positive and they're with the employee bringing that to work and it's found out that it came from their home and a friend, is there any exposure liability on anybody's part there?
So the indirect exposure is definitely a difficult question, particularly where the employee themselves has not actually been exposed to COVID. They wouldn't necessarily fall under any sort of you know, initial quarantine as required by DHS. So they are going to want to monitor their own symptoms and obviously keep an eye on, in this case, their child. If their child ends up becoming symptomatic and ends up having COVID, then they would be exposed. So I do understand that there is some fear that comes with the indirect exposure, but it does not automatically require a quarantine. When you have the sick child, however, you may get into a situation where you do qualify for the FFCRA leave because you would be potentially caring for an individual that is required to quarantine.
Sure, thank you.
And if I could maybe just add one point as the liability side of it all. I think from an employer's standpoint, just to be able to go back and really make sure you've got a strong policy that talks about when you're sick or if you've been exposed, what is your company expectation, and just making sure that that's clear to the employee, so the employee doesn't come back later and say, boy, I didn't know I was supposed to tell you when it was my kid. So just making sure that's clear to your employees would help with that, protecting that liability.
Sure. Dave, this is a question I'm sure everybody has on their minds. Can you give us a range of the costs from those public service options to the CVS's and the Walgreens to private organizations like yours? Just a general range, and do employers talk about their ROI? You touched on it earlier. By shutting down a company for 2 weeks, there's a significant cost to that versus testing every 2 weeks, which perhaps is quite an investment, if not more than that, if it's every 5 days. Could you just talk about that in general and
Absolutely. Yeah, thank you for the question. So from our perspective and the customers that we have worked with, we have not had a specific ROI discussion with them, but almost all of them, or I'd say unilaterally, have either been bitten by it or are aware of another company that did go through a shutdown and has heard the woes. Generally speaking, depending on what you want to accomplish, the price will be somewhere between $100 and $200 per employee for on-site testing.
Okay, great. Maureen, how long after the infection does a test have to be done to yield a positive, accurate result? I think someone stated that earlier, that somebody was positive, then negative, then positive.
Mm-hmm. Yeah, that is a mystery, isn't it?
Yeah.
There is, if you stay up with the literature, there is, timing is everything, first of all. I can tell you in situations where an employee has been exposed, not to say, oh, you got to hurry up and go out and get the test. If it's on the weekend, let that, I don't want to say let that incubate, but let them see where that's going. Dave had a very good point, and he even referenced that even if the employee tests negative, depending on what the exposure is, even allowing them to stay, having them stay quarantined for that period of time. And again, public health will direct on that. There is still, the science is out on how long the antibodies are around and if the antibodies weaken and if they come back. So, I hate to be so confusing, but it is something that the virus depends on the load of the virus that the person has been exposed to, and how much and how long they're shedding will have a difference. So even though 14 days is the magic number, there might be somebody that even without another test, you're going to know that they're still shedding virus at 21 days because they're symptomatic.
Sure. This might be a question for smaller to mid-sized companies, maybe not those companies with 500 or 1,000 plus employees, but should every person who has one of the symptoms, sore throat, nose, etc., get sent home for testing? What if it's a cold? At what point do you say, okay, I've got a sore throat or runny nose, I need to get tested?
I can jump in there, Dan,
Sure,
just to offer my thoughts. What we do at our own facility here is, and I guess Brittany and Maureen, you can tell me if I'm off base, because if there's a problem, Brittany's going to represent me and Maureen's going to protect me. So my thought here is what we did very early on when the pandemic started is we started to adopt CDC guidelines on respiratory illness. And we sat down with all of our team members and said to them, here's the expectation, here's what you want to look for. If you or someone you're near is exhibiting this symptom, call us before coming into work. And that's how we've been managing it. Now, we, of course, have the ability to test our own team members, so we're at an advantage. but that's what we've been recommending to our team internally.
Sure. Anybody else want to weigh in on that?
I certainly follow what Dave's lead is, and I guess the related question that I receive a lot from employers is they have the employee that has seasonal allergies or chronic headaches, or the air conditioning is irritating their throat all the time. So I always also make sure when you're doing that education, getting them to understand new symptoms versus something that's more long-standing or chronic for them.
What do you do when an employee's spouse has a positive test? Brittany, you might have touched on that. That's the indirect contact.
So no, if it is the employee's spouse who has COVID-19, they have been directly exposed. And then at that point, yeah, we would want them to quarantine, and they could reach out to their healthcare provider, and then your healthcare provider could advise you to quarantine to then you qualify for the emergency paid sick leave.
What's my liability risk when a positive test occurs? I don't know if that's individually or from an employer's perspective.
I did see that question. It's a little broad because there are all sorts of liabilities, there in terms of the employer's liability to the ill employee. This is likely covered by workers' compensation, although there is the potential for an increased penalty in certain cases where you have safety violations or reckless conduct if you don't have any sort of infectious disease or COVID-related precautions you're implementing, which then ties in with a potential OSHA liability. But otherwise, in terms of other litigation, the primary one would be the workers' compensation. And Maureen may have anything to add on to that, particularly in regard to OSHA.
Yeah, it'll all come down to that investigation portion of it. And as each of us have said, it really starts with having a strong infection prevention plan. And the last thing I'll say about that plan is, don't worry if when we get through COVID, it's going to be a plan that I've had other employers say they used it with a prior outbreak, and we will unfortunately have another outbreak someplace in the future. Maybe not, hopefully not to this gravity, but it will be a plan you will go back to again.
Yeah. Dave, I've seen news reports that indicate the COVID virus is more prevalent among lower socioeconomic classes. Can I, as an employer, focus my testing program on specific groups of people?
That's a really good question, and I would probably default that one to Brittany. But my thought is, we don't want to discriminate against anyone. Everybody needs to be tested equally. But Brittany can certainly talk about that. From an information or data collection point of view, the state of Wisconsin hasn't trended towards lower socioeconomic. Now, it could be that that question is coming because that's typically underrepresented. But if you look at the data, there's some very clear indications of where increases in infections are taking place and what group and age group that is occurring in. But I'll turn it over to Brittany. She's the expert in that area.
Yeah, I agree with you, Jay, that you do not want to implement a testing policy that is targeting individuals, particularly in any sort of protected class. You're just setting yourself up for a potential discrimination claim there. So, you want to make sure that your policy is being applied in a non-discriminatory and fair manner.
Something related to that. Oh, go ahead, Dave.
I was just going to say also, Dan, just think about it in terms of, are you a human being? So the virus doesn't care anything about you other than do you have a specific cell that I'm looking for. So sure. If that's the case, everybody is equal in this virus.
For sure. Just to be clear, did you say that we can't ask the employee for their test results for our own documentation? That was during the program at some point, on the front half of the program. Might have been
Yeah.
on speaking. Brittany.
So I know there were a lot of questions about what kind of documentation can we require, and there are limitations for emergency paid sick leave with what you can request. In terms of returning to work, it is not a no. The CDC is recommending that you don't require a negative test or a letter from a healthcare provider. And the main reason for that is how overrun they currently are. But there's nothing barring you from doing that. Again, if you are going to have those requirements, you need to be sensitive to the fact that employees may have difficulty getting that. So just make sure that you are, being understanding of that.
Mm-hmm. This might have been addressed, Maureen. How soon does COVID show up in someone's system after exposure?
Boy, again, I've read literature as long as 21 days, but it can be, as they're saying, 2 days before or 2 days after an exposure. So it is a wide range. There are other variables that really have an impact, and that is, do you have pre-existing conditions, pre-morbid, diabetes, respiratory issues, some of these other factors. And it has a lot to do with how long was the exposure, how heavy was the load before. I mean, there are healthcare workers that have a very heavy load, sure, and it's taken a longer time.
And on the flip side, this might have been addressed, but I'm kind of curious as well. When is it safe for the employee to return after they've been diagnosed with a positive? Do they need to be tested again, or is it just that 14-day period?
So the CDC currently has a time or test guideline that they're following.
Okay.
I know we'd all like to see 2 negative tests out there, but there isn't enough. It's the amount of testing available and the time that it takes to get the testing. So they are still, unless Dave has picked up on something that I haven't read yet, they're still allowing a time period. And again, at least 14 days after that positive test, and then time, it would be extended if they were still symptomatic.
Mm-hmm. Dave, anything?
Yeah, I agree with Maureen. The 14-day has been the classical isolation period. I have read that, and even some anecdotal evidence, but I've read that we are still able to shed the virus, the infected particles, for a period of time after that 14-day period. And I'd go back to one of my earlier examples where we had a patient in May positive, June negative, early July positive again.
Another question, perhaps, Maureen, if departments are in separate buildings, does that change protocols?
So I saw that question, and certainly for the limited information that we have, I would say yes. Again, I'll go back to that ruling of within 6 feet for 15 minutes in the last 72 hours. Now, what I would say, based on what I was reading into that question, you might not have to, if you had exposure in building A, worry about building B, but you also want to go back and say who's riding together. Are they using the same bathroom facilities? Are they eating in the same lunchroom? Are they transferring equipment or supplies between buildings? And then that would be a consideration.
Mm-hmm. Brittany, I think this one would be for you. With the FFMLA, with the 80 hours of paid leave, can an employee use 40 hours for themselves, being sick, and the second 40 hours to take care of a son or daughter?
Yes, you can.
Great.
They're really quickly, just while we're talking about FFCRA, I skipped over it in my outline. I did have a note that there are a number of exceptions that apply to small businesses, so employers under 50. And so I did see there were a few questions about that. There is helpful information in those Department of Labor Q&As about small businesses. So if that applies to you, make sure that you take a look at that. And there are some limitations or exceptions to what leave you need to provide if it is, I think the phrase, if it like affects the viability of your business. I'm not looking at it right now, but definitely make sure you take a look at that if you're a small business.
And another one for you, if an employee goes for testing at their own discretion due to potential exposure, no symptoms, does that qualify under FFCRA EPSL reason number 2?
No, it is our understanding that you need to actually have a healthcare provider, as that is defined, tell you to self-quarantine to fall under that. So if the employee is looking to take that leave and they request it from you, you need to let them know to see a healthcare provider to get that medical advice. And they may even be able to do that via telemedicine, since that is something that we're seeing a lot, and that would be acceptable also, a telemedicine visit.
If an employee was tested once during this period, can they be asked to take additional tests in the future?
Yes.
Anyway, yeah.
I don't think there's anything that would limit that, particularly where, you know, there is a time lag, and just because you get tested on Monday, you know, you may be exposed and develop it, you know, before you even get that test result back, depending on where you go.
Dave, this might be for you. Do you have data comparing the accuracy of the different nasal tests?
Sure. So that accuracy would be contained in the EUA, or the emergency use authorization that is issued for the test. And I would ask that whoever is looking for that information head over to the FDA site and take a look at that. There are many, many pages and examples of the accuracy and validation data for the different types of tests.
Thanks. Can you use an employee's PTO if they test positive?
Yes, I mean, if they are choosing to use that, you can't force them to use that before their emergency paid sick leave, but they can choose to use that.
Can someone refuse a temperature check on religious grounds?
That is, you know, there is this exception for sincerely held religious beliefs, and so you'll want to kind of go through the process with them. And I would say with temperature checks, I know Dave has probably talked about this, and he's at least mentioned it in the chat or some of the questions. There is a question of how reliable that is. So I don't know if that is the, you know, hill you want to have this battle on over temperature checks. So really consider how reliable those are, how much information that is giving you. You know, I know a lot of employers are doing temperature checks. A lot of employees are asking to do it. It helps to reduce employee fear. But you're creating confidential medical information, and it's not necessarily that reliable, and can create a false sense of safety too. So, you know, you got to decide what is best for your business and what is best for your employees.
This is somewhat related. What if an employee has one symptom, no fever, and wants to take the EFMLA due to COVID? Do you have to provide?
So the EFMLA is the 12 weeks that is only for caring for a child. If they're looking at the emergency paid sick leave and they have not been advised to quarantine by a healthcare provider, and they're not currently seeking a medical diagnosis, they would not qualify under that. You need to be experiencing symptoms, even if it's just one, but also seeking a medical diagnosis.
Mm-hmm. Dave, what level of contact should be considered as high risk when performing an internal contact trace program for an employee who tests positive?
Wow, that's a great question, and probably, Maureen, if you could help me jump in there, I would say probably proximity of 6 feet or less.
Right. And 15 minutes.
And 72 hours.
In the last 72 hours.
I even remember that, Marie. I like that. You got to break it down so it's simple. That's how I relate.
But again, then you still got to add, was it outside? Was it?
Were they wearing masks? And
yeah.
Are employees responsible for the cost of tests the the employer has requested. I doubt that.
I haven't seen that at all, Dan.
Yeah. Any other burning issues? There are a whole bunch of other questions. We're coming to the end here. There's a few more minutes left. I can continue to rattle off some, but are there other things that the three of you want to make sure that you express?
I saw a question for the care of a child, and I know a lot of people have, whether it's a nanny, it's grandma, it's a neighbor who watches their children. They do count as a child care provider who may be unavailable due to COVID-19. So you're not excluded just because you're not in some sort of, child care institution. Those kind of other arrangements would also qualify. So just make sure you're documenting, this is kind of our situation. This is my child care provider, and there's no one suitable to care for the child.
Mm-hmm.
And Dan, I saw a group of questions that came out of some of the school practice groups.
Right, yeah.
And I just want to just reference back again, CDC has some guidelines very specific to education. So does the Wisconsin Department of Instruction. There are a variety of other national organizations, transportation of students, food service workers, food service services, as well as musical instruments. So please, with a simple Google search, you're going to be able to gather up some very good references on there that they have some good practice statements. And I'll leave you with, if you got a tuba in your band, make sure you got one tuba player or multiple mouthpieces.
Sounds great. So real quickly, there's a question about OSHA, and there was some discussion about it. Does R&R, does Accelerated, do you provide OSHA compliance plans? I can't remember what you all said about that.
Yeah, in the my bank of slides, I gave you 3 links, I believe. CDC, OSHA, it'll take you right to that OSHA infection control plan, as well as R&R has a whole variety of topics, as well as a 30-minute webinar on how to contemplate that. So that's available. They can just reach out.
Okay. Anybody else on that topic? One last question. I know a lot of companies have temporary workers. Please address both regular employees and temp service employees as it relates to this issue. What are employers needing to know about that?
Sure. Well, I mean, you want to make sure in terms of, exposure, if you have regular employees that were exposed, assess whether there was any temporary workers that were also exposed, and make sure you're informing either that staffing agency or those employees, maintaining confidentiality, of course. And the same goes the other way. If you are a staffing agency and one of your employees comes down with COVID, make sure you're alerting the employers that they have been working with. And for the staffing agencies, you do have an obligation to ensure that you are sending your employees to a safe workplace. So you cannot just put your head in the sand and assume that the employer's workplace is safe. You should make sure that they do have some precautions in place and you feel comfortable putting employees there.
Great. Right, well, this wraps things up. Thank you all for your insights. Brittany and Dave and Maureen and Reinhart Boerner Van Deuren and Accelerated Analytical Laboratories and R&R Insurance Services. These are the experts, so you'll find their contact information on the next slide and the slide deck if you're able to access that. I did see a comment that the links weren't there. They will be available. The links will be there, and Brittany's cheat sheet or whatever she called it, that's going to be available there as well. If you have additional questions, I'm assured that these individuals will all help you navigate your way through this crazy COVID-19 pandemic. So as I mentioned, the slide deck will be available online. It should be available momentarily. The webcast will be available tomorrow on our website. But when you close out the tab, a new one will open. If you can answer that survey, that would be great. So please fill out the survey as we look to get your feedback for future webcasts. So we value your feedback very much. On behalf of our sponsors and BT360, Content Solutions, and BizTimes Media, thanks again, everyone, for taking time out of your day, and have a great rest of the day. So take care, everybody. Be safe.
Thank you.
Thanks.